I'm Basma Faris, former registered dietitian, now OBGYN and culinary medicine specialist. My friends at Girl Mantra asked me to come and talk to you about nutritional supplements for PCOS. Now, in general, I really do believe that we should get most of our nutrients from food, but there are a few supplements that I find really interesting because they have their potential therapies, and so we're going to talk about them today. The first one I want to talk about is something called inositol. Inositol is actually a naturally occurring sugar. It's found in some fruits like cantaloupe and citrus fruits and some whole grains and beans. And this small sugar molecule has been shown to have some biologic activity to improve insulin resistance. Now we know that the majority of women with PCOS, approximately 70%, do have some insulin resistance. And so improving insulin sensitivity can actually improve PCOS symptoms. Now, there are two isomers of this inositol. Isomers are similar chemicals that have the same chemical composition, but that are tweaked slightly so that they have a little bit of a different shape. And there are two isomers of interest. One is myo-inositol and the other is D-chiroinositol. And they've both been shown to have some benefit, but studies were really sort of conflicting and confusing until recently when a group or a few groups actually looked at combining the two at specific ratios. A recent 2019 randomized controlled trial was published that actually looked at women with PCOS, and they randomized them to different supplements with different proportions of these two isomers. And it turns out when consuming a supplement of 2 grams of the myo to D-chiroinositol in a ratio of 40:1, that actually conferred the greatest benefit. So women in this group actually had the highest number of spontaneous ovulation and spontaneous menses, and the largest decrease in their insulin resistance as measured by something called HOMA-IR. That's a lab study. That's a marker for insulin resistance. So it's actually found to be a very, very effective supplement and potential treatment for insulin resistance in PCOS. Now, some caveats. As with most treatments or any medication, there can be some side effects. So some people can experience nausea, vomiting, abdominal pain, headache, or dizziness. If you're already taking another insulin sensitizing medication, you want to be careful and make sure you talk about it with your doctor. And you want to make sure if you are going to try one of these supplements that you are purchasing one that has the ratio of 40:1 in a dose of about 2 to 4 grams per day. Next, I want to talk about another insulin sensitizer. It's a compound called berberine. Now, berberine is actually an herbal therapy. It's derived from the bark and stems of some plants like the berberry tree or the golden seal. Oregon grape is another source. A few different plants are a source of berberine. And I'm admittedly not an herbalist, and so I'm really not an expert in herbal medication, but I just know that the berberine acts very similarly to metformin, which is an insulin sensitizer and a medication that we often use in women with PCOS to improve their insulin sensitivity. And so you want to be careful if you're already taking metformin or if you're already taking inositol, because there may be some interactions. Another big caveat with berberine is that it can actually increase or decrease the activity of other medications that you're taking. So any medications that are metabolized in the liver can be affected by this supplement. So make sure that you review with your doctor before you try it, but it can be effective.